Good day everyone, my name is Gretchen Teves and my report is all about reproductive health laws around the world. So during 1960s and 1970s, there were extensive efforts to catalog the legal standing of abortion, contraceptive pill, condom, intrauterine device or ID, and sterilization around the world. With explosion of population growth rates and the emergence of modern contraceptive technologies, the legality of abortion and contraceptive methods became an important item on the reproductive health. However, with the emergence of HIV/AIDS in the 1980s, HIV or AIDS-related research took precedence in the new reproductive health agenda and placed critical examination of laws surrounding abortion and contraception by the wayside. So, during 1960s and 1970s, the legal standing of abortion, contraceptive pill, condom, intrauterine device, or ID was become a law around the world. This because of the explosion of the population growth rate. Another reason is to help women and couples achieve their desired family size and to control their timing and spacing of births. And with the emergence of HIV or AIDS in the 1980s, the contraceptive birth control like condoms can prevent both pregnancy and the transmission of sexually transmitted infection, including the HIV. The reproductive health laws. Abortion law. Abortion law vary widely among countries and territories and have changed over time. Many countries and territories that allow abortion have gestational limits for the procedure depending for the reason, with the majority being up to 12 weeks for abortion on request, up to 24 weeks for rape, incest, or socioeconomic reasons, and more for fetal impairment or rest in the woman's health or life. Abortion continues to be a controversial subject in many societies or on religions, ethical, practical, and political grounds, and abortion continues to be common in many areas, even where they are illegal. So, countries around the world allow on abortion, but it is depend on the reason, with the majority being up to 12 weeks for abortion, up to 24 weeks for rape, incest, or socio-economic reasons. So, if your reason is belong to the majority, you are allowed for the abortion. Abortion is one of the safest medical procedures, but it is also the cause of at least 1 in 6 maternal deaths from complications when it is unsafe. Abortion was considered a sin of the transgressions of morality, and the laws were intended to punish and act as a deterrent. The following summary of abortion laws and practices in these following countries shows this often leads to complex policies governing when and under what circumstances a woman may legally have an abortion. North America, Latin America, Western Europe, Eastern Europe, Africa, and Asia. North America. In Canada, since 1988, when the Supreme Court of Canada ruled the existing abortion restrictions were unconstitutional, abortion has been legal for any reason at any stage of pregnancy. Mexico. In Mexico, abortion allowed only in instances when the mother's life or physical health is at stake in pregnancy involving possible fetal abnormalities or in cases of rape. Mexico City became the first municipality to legalize abortion within the first 12 weeks of pregnancy. Latin America. In Brazil, abortion is legal in Brazil only in cases of rape or incest or when the mother's life is in danger. Under federal regulation, hospital requires a formal determination that a pregnancy has resulted from rape or incest before informing an abortion. In Chile, in 1967, the Chilean Health Code formally legalized abortion when it was necessary to save the mother's life, but it in 1989, the measure was reversed by President Augusto Pinochet, who made abortion illegal in all circumstances, and in 2006, President Michelle Bachelet authorized government distribution for the morning after contraceptive pill to women aged 14 and older, but in 2008, Chile's Constitutional Tribunal suspended the program. In Colombia, abortion was illegal in all circumstances until 2006, when Colombia's highest court ruled that the procedure can be performed in cases in which the mother's life or physical health is in danger. In cases rape or incest, this decision has been the object of strong protests by abortion opponents. But in August 25, 2006, the first legal abortion was performed on an 11-year-old who had been raped by her stepfather. In Nicaragua, abortion was only in cases of rape or cases in which three doctors agreed that the mother's life was in danger. Western Europe. In Greece. Since 1986, abortion has been freely available in Greece during the first 12 weeks of pregnancies in instances of rape or incest. In Spain, abortion law in Spain legalized the procedure at any point during pregnancy in cases in which the mother's life or physical or mental health is at risk. In Sweden, since 1974, abortion has been legal in Sweden in all circumstances within the first 18 weeks of pregnancy. After this point, abortions are only permissible to save the life. Eastern Europe and Poland. In past 1993, abortion is legal in Poland throughout pregnancy to preserve the life or physical health of the mother. During 12 weeks of pregnancy, abortion is also allowed in circumstances of rape. Russia. Abortion is freely available during the first 12 weeks of gestation as well as at any point during pregnancy in cases of the health of a mother and severe fetal abnormalities. In Slovenia, abortion was also allowed in cases that threaten the mother's life or cases that involve severe fetal abnormalities. Asia. In China, abortion is virtually freely available in China, and there are no defined time limits for access to the procedure. Although sex-selected abortion is prohibited, critics say that China's one-child family policy, widespread abortion of female focuses by couples intent of having a son. In India, abortion is available in India in cases in which the mother's life or physical or mental health is at risk, or social or economic reasons. In Japan, abortion is allowed in cases of rape and for economic or social reasons. In Philippines, abortion has been illegal in the Philippines since 1930, when it was first criminalized. The only acceptable reason for an abortion is when the mother's life is in danger, in which case permission of the abortion must be obtained from a board of medical professionals. Contraceptive pill, condom, and ID laws. The Program of Action of the International Conference of Population and Development, or ICPD, includes a clear commitment to ensure that women and men have access to the widest possible range of safe and effective family planning methods in order to enable them to exercise an informed choice, while recognizing the appropriate methods for couples and individuals according to their age, parity, family size, preference, and other factors. The assessment of progress towards this target requires monitoring of key family planning indicators, including the range and types of contraceptive methods used. The prevalence of specific contraceptive methods varies widely across the world. Governments at all levels have played a strong role in promoting and legitimizing the provision and use of family planning and reproductive health care and the use of specific methods. So, contraception is the intentional prevention of conception through the use of various devices, sexual practices, chemicals, drug, or surgical procedures. Those any device or act whose purpose is to prevent a woman from becoming pregnant can be considered as a contraceptive, and the effective contraception allows a couple to enjoy a physical relationship without fear of an unwanted pregnancy and to ensures enough freedom to have children when desired. The different types of contraception. Cup. So, cup is like diaphragm. Is a barrier method or contraception is fit inside your vagina and prevents sperm from passing through the entrance of your womb. Confined pill. Women can take emergency contraceptive pills to 5 days after unprotected sex, but the sooner the pills are taken, the better they will work. Contraceptive injection. So this is when women get shots to the hormone progestin in the buttocks or arm every 3 months from their doctor. Contraceptive patch. This is a skin patch is worn on the lower abdomen, buttocks, or upper body, but not in the breast. It releases hormones progestin and estrogen in the bloodstream. You put a new patch once a week for the 3 weeks, and during the 4th week, you do not wear a patch so you can have menstrual period. Diaphragm. In this barrier method, it is placed inside the vagina to cover the cervix to block sperm. Before sexual intercourse, you insert them with spermicides to block or kill sperm. Female condoms. It is worn by the woman, and female condom help keeps sperm from getting into her body. It can inserted at to 8 hours before sexual intercourse. Male condoms. So, it is worn by the man. A male condom keeps sperm from getting into a woman's body. It is the also prevent pregnancy and HIV and other STDs as to the newer synthetic condoms. Intrauterine devices or IDs. It is placed inside the uterus by the doctor. It releases a small amount of progestin each day to keep you from getting pregnant. This stays to your uterus for up to 3 to 8 years depending on the device. Implants. The implant is a single, thin rod that is inserted under the skin of a woman's upper arm. The rod contains a progestin that is released into the body over 3 years. Effective contraceptive is the key to women's well-being and autonomy. Family planning reduces women's health risks, decreases infant mortality, reduces the incidence of abortion, and slows population growth. Some types of contraception, such as condoms, also help prevent the transmission of HIV and other sexual transmitted infections. The voluntary sterilization laws. Surgical techniques for the sterilization of men and women were developed 100 or more years ago, but only in the past 20 to 25 years has widespread reliance on sterilization as method of contraception became both medically feasible and culturally acceptable. Nevertheless, in those few decades, voluntary sterilization has gone from being rarely used contraceptive technique to being the most widely used method in the world. Voluntary sterilization has many advantages for family planning programs. In developing countries, most important when the procedure is performed correctly. Sterilization's failure rate is lower than that on any other contraceptive method. There are 8 countries in which anywhere from one-third to half of all sterilizations each year are vasectomies in increasing rank order. These are China, New Zealand, the United States, Sri Lanka, Denmark, Australia, Nepal, and Norway. With regard to trends, it examined that incidence of male and female sterilizations rates increased in 7 countries, which is Bangladesh, Colombia, Finland, India, Indonesia, Nepal, and the Philippines. And that's all. Thank you for listening.